Alzheimer's disease is when sometimes the old people, sometimes the young people gets it too, is when they tend to forget who they really are and where they are, and their environment does belong to them.
L'Alzheimer est une maladie dégénérative du système nerveux central qui provoque des troubles du comportement et des troubles physiques qui peuvent être très graves et qui peuvent amener la personne à être hospitalisée dans des centres spécialisés.
It's a disease that comes on, usually older in age. Sometimes it gets confused with dementia. It causes problems with people being able to understand. Their mind will not process the same way as it has in the past. And sometimes my wife looks at me when I ask a question for the third time and says, "That's what I'm doing."
It's a sort of, I would say, temporary disconnection and also memory loss. And this, I think, happens often with people that are more or less all by themselves, or sometimes too long by themselves, and no one to really communicate to, no one to dialogue to. And this is one of the, I think, one of the causes of this disease, really.
It's a disease that will make you forget, give you lots of memories. Some get it at an early age and some get it at an older age.
Alzheimer's to me is a disease that causes you to lose your memory, and I think it touches mostly old people, and it's been hitting a lot of people these days.
When you get old, you start to forget things about your past, and it's hard because you forget everything about your family, your friends, what you did, what work you did, your studies, and everything. You forget everything.
C'est une maladie grave et qui malheureusement est très fréquente partout. En Europe, ici, sur les Caraïbes, partout. Hein. Et ça vous tombe dessus parce que j'avais une amie, une cliente de Luxembourg, vraiment une amie mais qui était très chère, et elle a attrapé ça, étant très jeune encore, et c'est horrible. Hein. Parce que la pire des choses, si vous ne savez plus ce que vous faites et si vous ne reconnaissez plus votre propre famille, vos parents, vos amis, ça c'est très grave. Et personne n'est à l'abri d'eux. Hein. Personne. Hein. Ça peut tomber dessus. C'est pour ça que moi je dis toujours, il faut vivre sa vie et il faut profiter de la vie. Hein.
Alzheimer's to me is a disease that diminishes your mental capacity, and it happens at all ages. So.
Alzheimer's is a disease where the elderly people, especially they are 65 years and up, they start losing the memory, and it affects them in the later stages of their life, where they cannot remember their family members, they cannot remember where they have kept some items, and it becomes difficult for them to survive on a day-to-day basis.
Alzheimer's is when a person is forgetting stuff, basically. They forget things faster than others, I would say.
For me, Alzheimer's, and there's two differences. There is one that affects the older generation, older people from 65 years and up, where you start to forget little things as where you put your phone or where you put something, and then it starts that you cannot remember your family member name or your last name or big things. That's Alzheimer, and it do affect all ages, not only senior citizens. It affects also young children just born or children that's going to school. Sometimes you fall and it damages a part of your brain, and that's how it starts.
Alzheimer's disease is a condition in which nerve cells in the brain die, making it difficult for the brain's signals to be transmitted properly. Alzheimer's symptoms may be hard to distinguish early on. A person with Alzheimer's disease has problems with memory, judgment, and thinking, which makes it hard for the person to work or take part in day-to-day life. The death of the nerve cells occurs gradually over a period of years. Common symptoms of Alzheimer's disease include impaired memory and thinking, disorientation and confusion, misplacing things, abstract thinking, trouble performing familiar tasks, changes in personality and behavior, problems with language and communication, and impaired visual and spatial skills. Currently, no definitive diagnostic tests for Alzheimer's disease exist. A definite diagnostic of Alzheimer's disease is possible only after death, when a pathologist can more closely examine a patient's brain for the telltale changes associated with the disease. Because the exact cause of Alzheimer's disease is not known, there is currently nothing that can be done to guarantee its prevention. Some interventions may be worth incorporating into your life as more research reveals some potentially controllable risk factors. Staying mentally and physically active, maintaining a normal blood pressure, and avoiding head injury by wearing seatbelts and helmets may decrease your chances of developing Alzheimer's dementia. It is important to remember, however, that there are causes of dementia other than Alzheimer's disease that may be preventable by such means as eating properly, exercising, quitting smoking, and limiting how much alcohol you drink. Your doctor can advise you about other healthy lifestyle habits you can adopt that may help prevent dementia. Many people are unsure what the differences are between Alzheimer's and dementia. Dementia is an umbrella term that describes a set of symptoms that can be present in a variety of conditions and illnesses. Alzheimer's is a progressive brain disease, and it is the most common cause of dementia. Alzheimer's disease and dementia are often used interchangeably, yet they are not the same thing. A person who suffers from dementia may or may not have Alzheimer's, but everyone who has Alzheimer's will suffer from dementia. Alzheimer's disease is a condition that causes the gradual destruction of brain cells. Over time, the illness causes dementia by progressively robbing the patient of his memory, learning ability, communication skills, and capacity for self-care. In most Alzheimer's patients, the symptoms first appear after the age of 60, but Alzheimer's is not a normal part of aging. Alzheimer's starts in the part of the brain that stores recent memory, then slowly spreads to other areas of the brain. The disease progresses through the brain at different rates, usually lasting from 3 to 20 years. Scientists are not certain what's the cause of Alzheimer's.
On the behalf of the Collectivité of SAINT-MARTIN, there will be an information session on Alzheimer's disease on March 25, 2015 at the Chamber of Commerce, CCI, located in Concordia from 5 p.m. to 8 p.m. Come out and learn about this health issue and its effect on the island. Partners of this event includes Bethany Home, Social Security, CGSS, Regional Health Agency, ARS, Association St. Martin Health, St. Martin Alzheimer's Foundation, Association Alzheimer's Guadeloupe, 4 community councils, Rotaract Club, Chamber of Commerce, True Hope St. Martin. Come out and learn about this health issue and its effect on the island.